Mental health care has come into the community through family health teams, an innovative way of delivering health care. No two teams are exactly alike, as each team adapts to the needs of its community. Rural communities are providing mental health care workers so that those in need can access resources closer to home. Hopefully, that will encourage more people to take advantage of the help and get early intervention. This is Diane Bederman. Welcome to the many voices of mental illness.
Manic depression is searching my soul. I know what I want, but I just don't know how to go about getting it.
I visited Kim Bell, a mental health care worker at East Wellington Family Health Team in Erin, Ontario, 45 minutes northwest of Toronto, to talk about these teams and the mental health care available for children and adults at these clinics. What is this clinic? What do you do here?
I have a dual role here. I'm a program lead as well as a mental health worker. So here we're a primary care clinic. It's a doctor's office where people come to see their family doctors. But under the family health team model that was introduced to Ontario in 2005, we have adjunct services that help support the doctors in their work with patients. So my program lead role is developing programming for the general community for people who don't have to be patients here. And we offer workshops and public sessions. So that's one part of what I do. And the other part is as mental health worker. So if some of the family doctors are seeing patients who are struggling with mental health issues, they will refer to either myself or my colleague, the other mental health worker we have on staff.
When someone is referred to you by the doctor, what do you do for them?
It depends what their needs are, and they really are diverse. So we have everything. We see everything from someone who's experiencing workplace stress and are having a really hard time coping. It's coming across in things like disrupted sleep, poor eating patterns, increased agitation or anxiety. So we'll talk to them about coping strategies around the stress so that they can better manage it. For others, they're experiencing a chronic disease and are then experiencing depression associated with that, with any kind of physical limitation. For others, some come to us with a history of abuse and wanting to work through that. Marital issues, other interpersonal relationship issues. It's really quite a wide spectrum of issues that present themselves.
I want to talk to you specifically about depression and bipolar disorder. If I'm a patient in the clinic, so I would wait in the waiting room with everyone else,
Yes.
Would people know that I was coming to see you, that I was coming to see a mental health care worker?
No, and that's the beauty of it. We have, it's very much a mainstream service. So, as you said, people are waiting out in the waiting room much as they do when they come for strep throat or a chest cold or something like that. So they're sitting out in the waiting room, and for all anybody else knows or sees, they're there to see their family doctor, when in fact it's, who comes out to get them is my colleague or myself.
What is it about mental illness today that people don't want others to know that they're dealing with a mental illness?
It dates back decades, because the stigma associated with mental illness, we don't treat it like we treat other illnesses, and it is a physical illness. There are chemical changes that happen in your brain, either because you have a biochemical imbalance that causes the symptoms of depression, or you're involved in a life event or situation that causes depression. You still have a biochemical change in response to that situation. But we don't tend to treat it that way. We tend to look at it, society tends to look at it as a weakness, something people that should just be able to give themselves a kick in the butt and get over and get through. If they exercise more, if they, things like that, that it's really mind over matter. I think society is starting to come around more, especially in the last 10 or 15 years, where it is more accurately recognized as an illness requiring treatment. But the stigma is still there, that it's a weakness. When I've done training sessions in the past, I've asked people, if you were to go to your doctor's office and be diagnosed with high blood pressure or diabetes or arthritis, how many of you would feel comfortable going back to your workplace and say, wow, I was just diagnosed with one of those things? And most everybody puts up their hands. And then I'll say, how many of you, if at that same appointment were instead diagnosed with depression or anxiety, would feel comfortable? And very, very few people put up their hands. So we treat it differently.
What do you think we can do to help take away the negative response to mental illness, not only from outside people, but there still tends to be a sense of shame, and people tend to keep quiet the fact that someone in their family is mentally ill.
And again, going back to that stigma of weakness, I think the more we talk about it, and you'll notice, I mean, interviews such as this, and shows coverage such as this go a long way to making it a more commonplace topic. It wasn't that long ago that cancer was a taboo word. And now we have campaigns and runs and walks and all kinds of things, and everybody wants to support that cause. And I think the more we talk about it and the more people acknowledge that it exists, it's not one of those weird, freaky, rare things that only happens in other people's families. It's 1 in 5. The national statistic is that 1 in 5 people will experience a mental illness in Canada. 1 in 10 will experience depression. And that's probably a conservative estimate. That's taking into account the number of people who are willing to go on record as saying they have depression or seek treatment. So as I said, it's probably conservative.
I'd like to talk about children over 10, under 18. There's more mental illness and depression showing up in young people today. How does it manifest itself so that a parent would be able to see there's something wrong? The same way that if a child says their throat hurts, you might go to the doctor. But as a parent, what would I be looking at to indicate that there's something really serious going on? It's not just some kind of sadness.
And it's a good question, because the teenage years are very often fraught with things like moodiness, mood swings. There are hormonal changes in a young person that may have them behaving differently. But what we encourage parents to do is look for significant changes in their child's behavior or mood or habits. So, for instance, a child that is normally fairly outgoing all of a sudden becomes withdrawn. They're withdrawing from school activities. They may experience difficulty with their grades and with schoolwork. They're not hanging out with their friends as much. Their appetite might change. Their sleep pattern might change. So we're asking parents to really be vigilant about questioning those changes that they see and not just chalking it up to routine teenage behavior.
When a child starts exhibiting signs, is it something that comes from a sudden change in brain chemical, or are children facing different kinds of triggers that will trigger depression or bipolar disease?
It can be either of those things. For some people, especially for children, if they have a direct relative who has a history of depression or bipolar disorder, of a mood disorder, so as a parent, they have a higher risk of developing a mood disorder themselves. In addition, I don't think I'd want to be a kid in school these days. The pressures are so great. There are things that we never had to worry about. Cyberbullying. There are more drugs and weapons and things like that in school. Fortunately, we're in a small community. Weapons haven't become a big issue. Certainly, there's pressure to perform, both academically, extracurricularly. I think kids are being pulled in a number of different directions, which causes a lot of stress. And stress is can be a precursor to a mood disorder like depression.
You must be a patient of this clinic to access mental health care. The staff ensure that patients don't fall through the cracks as they make their way through the mental health care system.
So they go to their family doctor, they're talking about symptoms where the doctor says, I think you may benefit for some counseling, and they come here, and in speaking with them, we may find that there's more going on, that they may have an addiction, that they may require psychiatric assessment, that they've experienced medication but not found one that's worked for them and really need a kind of a medication assessment and overall evaluation. For some that have intensive histories of, say, childhood sexual abuse that requires really specialized support, we will then refer to that program or service. Sad thing being that there are very often waits for those kinds of services, and it can be anywhere from weeks to months. So for instance, our surrounding areas, to refer to a psychiatrist, the wait can be anywhere from 2 to 8 months for that initial consultation. So we're not just going to say, well, you're a little beyond our scope, we're going to refer you, and that's that. We will refer them, but in the interim, continue to see them so that they are well supported until they get to that specialized service. And then we may re-enter the picture depending on what that specialist recommends. So they might recommend ongoing counseling for certain issues in that person's life, and we can help with that.
If you could change the way we manage mental health care, what would you want to see changed?
The wait times. When somebody has a mental health crisis, it's now. It's not 3 months from now. I would also like to see, and I think it's happening as well, less of the cookie cutter approach where here's the service we offer and here's how it's structured, take it or leave it. And as I said, I think with mental health reform we are changing so that it's important that we offer people choices. If this kind of service isn't for you, perhaps you'd be more interested in this kind of service. So for instance, hospital-based services are becoming less frequently used than community-based services because people aren't always comfortable going to hospital for the services that they need. So I think just more of that choice, but also the biggest thing is reduced wait times.
Care for mental illness has changed since I first came into contact with the mental health care system more than 30 years ago. Family health teams are providing mental health care in the doctor's office as part of whole body care. Hopefully, integrating mental health with physical health will begin to reduce the stigma of mental illness and the fear the public seems to have about people with mental illness. This is Diane Bederman. You are listening to The Many Voices of Mental Illness. The nastiness of my mental illness is the speed with which it reaches out and grabs me and takes me down into the vortex, stripping me of all joy, exhausting me. Yet I have a life to live, so on those days I get up and get out and work hard at planting a smile on my face. I know from experience that being the someone with depression, sucks all the energy, all the lifeblood out of a room. I have to decide, do I share my feelings with someone today? And if I do, who's the lucky one? You can't go back to the same trough over and over, or your circle of friends will diminish. This is the face of mental illness, a silent killer. We tend to ignore that mental illness, like other chronic illness, takes a physical as well as emotional toll on families and friends. No one is immune from mental illness. I know that caring family and friends can and do make a difference in the life of someone living with mental illness. This is the reason we need family support systems and respite care for those dealing with mental illness.
When you're down and troubled and you need a helping hand and nothing is going right.
My depressions come less often these days, and I begin to think that I have it licked. And then there are days when I wake up down, anxious, sad, and weepy. No reason. And that's the depressing part of mental illness. There's rarely a warning, not for me, not for my family. My partner knows the moment he sees me in the morning. He sees the sadness wrapped around me. And the problem with that is it can be contagious. If he isn't careful, the sadness will stick to him. Sometimes my depression comes with paralyzing anxiety and utter panic.
Winter, spring, summer, or fall. Now all you got to do is call, and I'll be there, yeah. You've got a friend.
I spoke to Jacqueline Long, a social worker in Guelph, Ontario, to learn about her 12-week family support program that helps families live their best life while supporting loved ones with mental illness. I met Jacqueline at Trellis Mental Health and Developmental Services.
My role at Trellis is I help support family members who have loved ones with mental health issues. So I help walk the families through and navigate the mental health system and support them on their journey. I like to think I educate families, I advocate for families, and I help support them.
When you talk about advocate for them, can you explain that a little bit more?
So a lot of families, don't know what's out there with regards to our mental health services. Guelph has a lot of great mental health services, but families don't know how to get in contact and who resources are. So what I'll do very often is sit with the families, find out what they need, what their menu of services would be, and then help them make those contacts. And if families aren't getting services, then I'm able to phone and find out where some of those barriers are occurring.
It sounds to me like you work the system for them and open the doors for them and provide them with solutions that they might not have thought of in the first place.
A lot of it is just having the awareness of where the services are. When you're in a crisis situation and supporting somebody with mental health issues and, things are really overwhelming, it's hard sometimes to find those services on your own. So I like to think of myself as sometimes a doorway to services. Also helping people not hit some of the barriers that they may hit. So if, for example, they don't qualify for a certain service, instead of them having to go through those doors and, do so many appointments to find out that they don't qualify, we can skip those steps and get them into the services they need.
So you take stress off, and I understand that stress is a trigger for mental illness.
Absolutely, yeah. So I find with families very often they're supporting somebody with a mental health issue, but their own mental health, can be an issue in that if they're not doing a lot of the self-care and looking after themselves. So part of it is the education of what's out there, but also supporting them and having them have some awareness around their own self-care for sure.
Trellis provides care for people who are referred by their family physician, a lawyer, and the police department. What I find most interesting, people can walk in off the street and ask for and receive help. As someone with depression, I find this comforting. Trellis is much warmer than any psychiatric unit I have visited.
The neat thing about Trellis is we also provide crisis services. So we have a mobile crisis unit. We also have walk-in crisis during the day. So if somebody is in crisis, instead of maybe waiting at the emergency department, they can walk through Trellis and get the mental health help they need.
Tell me a little bit more about this mobile service you provide.
It's been started within the last 5 years, and what it is, it's an after-hours mobile crisis service. It runs from 5 p.m. till 9 a.m. the following morning, and people can access it through the crisis line. They would call into the crisis line, and if it's deemed a quote-unquote mental health crisis, if it can be dealt with over the telephone, then it would be, but if not, then we would send a crisis worker out to the people's homes in Wellington, Dufferin, and they would have an assessment done and then get some help or get a support plan put in place until help can be provided.
You just call up my name, and you know wherever I am, I'll come running. Oh, yes, I will see you again.
The family would come, and I like to see families as a whole, holistic. So if it's a mother and dad supporting a child, then the mother and dad would come together. But if just the mom wanted to come or just the dad, that wouldn't be an issue. And the family would come and see me. We do 3 individual sessions and talking about their needs, some supports they can get, and what's going on in their lives, and really that menu of service that I was talking about earlier. And then what I do is I offer a 12-week family education group from there. So the 12-week family education group covers a arrangement of topics that are really relative for families. Definitely stigma is part of that 12 weeks. The families don't usually need education on stigma because they've most of the time experienced stigma themselves, but it's more education of what is your stigma as a family member, because sometimes that can be a barrier to service. Research shows that families in a higher socioeconomic status are usually slower to get help. So we talk about that and talk about the stigma piece.
Could you explain that, why people in a higher socioeconomic level would be slower to get help?
Well, I think that is the piece, the stigma piece, right? There's this idea about, who is allowed to have mental health issues. And, at the end of the day, we're all born with a physical health, the same way we're all born with a mental health. And at any time, either can go. And we talk a lot about how your physical health is interwoven with your mental health. One of the scenarios I give a lot, you have this brand new, beautiful new baby, and you think, whew, good physical health, wonderful. I got the 10 fingers, 10 toes. 16 years old, they're out driving, they're hit by an impaired driver, they're paraplegic, right? Their physical health has changed. It's no different with your mental health. You start out, you're brand new baby, you have this great mental health, and life stressors happen, and you can lose your mental health. So it's really reframing for families, the idea of what mental health is and what that looks like. Sometimes the issue with families isn't that the family has the mental health issue around stigma, but it's the person needing the services that don't want to get help because they don't want to be seen as quote unquote crazy. So then that can be a real frustration for families because they know their loved one needs help, but the loved one's not wanting to get help because of the stigma that surrounds it. It's a lot different when somebody goes into a psychiatric facility with a mental health break versus having a heart attack and going into an ICU unit. There's not the cake and flowers and balloons that come when somebody's in a psychiatric facility. So we talk about those pieces as well.
What is mental health? How do you define it when you deal with people and they can't understand why someone who's been so well and doing fine has suddenly crashed?
I like to not define mental health, but define mental wellness. And I think that's more important. So for me, mental wellness is mind, body, and spirit. It is a concept of not just absence of disease, but a wellness, a functioning. And at any point that can change for anyone. We're all born with a predisposition to mental health concerns, right? It's in our DNA, it's our genetics. And we don't have tests that can say, you have this much schizophrenia in your DNA. We're not there yet. Mental health is still very much like fever was in the 1900s. We have all these signs and symptoms, but it's all theories on what the causes are, right? So we all have a predisposition to mental health. It's in our genetic line. And some people will have a predisposition but never have a break, right? Will never experience a psychosis or be hospitalized for a mental health issue. Other people may. And what research is now showing is that life stressors are such a huge factor in that. And everybody knows their own life stressors, financial, breakdown of family unit. We see a lot with children's mental health, bullying that's happening in school and all of those pieces. And this is a huge factor on mental wellness. One of the biggest things we talk about in the family program is we talk about the stigma. We talk about self-care because that's so huge, right? Is how do I care for myself while trying to care for somebody else? And a good healthy boundary settings is another big piece of that.
Can you tell me what that means?
Yeah, so how do I help the person learn to help for themselves, right? I say with family members very often, if you're managing your loved one's illness, they're not. And they're the only person that can really control it, right? You can't control it. So it's empowering the person to be able to learn to care for themselves. So we talk about setting those good, healthy boundaries and supporting versus rescuing your loved one with mental health issues. So that's a really challenging. And then the last big piece of, I call it the trifecta of mental illness. So good, healthy boundary setting, self-care, and doing the grief work, because there's a lot of grief that goes along with the diagnosis of mental health issues for the person that's being diagnosed, but also for the family member. So they really need to help work with their emotions during those pieces. The other thing we do a lot with the family program is talk about recovery. So what is recovery? Because mental health is really based on the recovery model. So the loved one's recovery as well as the family member's recovery, and how those two recoveries may look similar or may look completely different, and some conflict that may arise out of that. From the family program, we do the 12-week family education group. We also do a boundary setting workshop because that is such a key factor. And then we also also offer a monthly drop-in support group for family members that have been through the program that just need some support of talking with people that really quote-unquote get it, that have that lived experience of caring for somebody with a mental health issue.
I think a lot of us think of grief as only coming after the physical death of a loved one, but grief comes from the death of a dream. Can you talk to that a little bit about finding out one of your member of your family is not who you thought they would be or could be?
Well, I think grief is associated a lot with loss. Right, and there's a lot of different types of loss, and it's from a society, it's reframing what loss can be. So it can be the physical loss, like you said, with a death or loss of a pet, but it can also be loss of hopes and dreams and desires. It can be the loss of sense of self. It can be loss of a partner. If you are in a marriage situation and it's your partner that has the mental health issue, you signed up for better or for worse, but you sure heck didn't mean mental health, and you wanted a co-parent and a co-partner and a co-contributor, and maybe those aren't possible at this time. So there's a lot of grief that's associated with mental health and a lot of losses.
Why are family and friends so important in the care of someone with a mental illness?
I can speak from experience with this is a lot of families, if they don't get the proper education and support, they may burn out themselves. And I use the analogy with family members a lot of the oxygen mask. So when you get on an airplane, the captain or the flight attendant will say you need to put your own oxygen mask on first. And as caregivers, the first thing we want to do is put it on our loved ones. But if we're not alive and breathing, then our loved ones aren't either. And if we wear out or burn out, no one's there to help support our loved ones when they may go in crisis, or even support them in their recovery, right? Because there's a lot of hope with mental illness, and I don't want to come across as not thinking there's a lot of hope, because there's a lot of hope with it, but they need the support in order to have those possibilities come true. Very often, people that are living on the street will be living on the street that have mental health issues, and they may not have families supporting them. So I think that's a big piece, and I mean, I'm sure the police can speak to that more, but very often we'll see the police become the loved ones' families, right? People that have the mental health issues, because the families are no longer able to care for their loved one.
Are there respite care programs for families who care for people with mental illness?
Yeah, that's a great question. There are. I wish there were more. In Guelph, we have Dinara House, and Dinara House has 2 respite beds for loved ones with mental health issues. 2 beds are great. 10 beds would be better, right?
We cannot treat mental illness by only caring for the person with the disease. Mental illness affects the family and friends, and it takes its toll on the community. Until I met Jacqueline, I had no idea that there were programs for families or that respite care was available. It's important to provide all kinds of care for mental illness. It is just as important to make sure that those services are widely publicized. Today we heard from Kim Bell and Jacqueline Long. For more information in Ontario about access to mental health care, contact Connex Ontario at connexontario.ca. Help is available 24 hours a day in 140 languages. This is Diane Bederman, Gotta Run, dinner guests tonight. Thank you for joining me for the many voices of mental illness.
Depression is searching my soul.